Welcome to the Medicare 360 show. I'm your host, Jennifer Lee, and today we are going over the Medicare New Handbook for 2025. We are on page 43, Home Health Services. Medicare covers home health services under Part A and or Part B. Medicare covers medically necessary part-time or intimate skilled nursing care, physical therapy, speech language pathology services, or continued occupational therapy services. Home health services may also include medical, social services, part-time or intermittent home health aid services, durable medical equipment, and medical supplies for use at home. Part-time or intermittent means you may be able to get skilled nursing care and home health aid services if they're provided less than 8 hours each day or less than 28 hours each week, or up to 35 hours a week in some limited situations. A doctor or other healthcare provider, like a nurse practitioner, must assess you face-to-face before certifying that you need some health services, home health services. A doctor or other healthcare provider must order your care, and Medicare certified home health agency must provide it. Okay. So we are going on page 44. 1 second. Okay, page 44. Medicare covers home health services as long as you need part-time or intermittent skilled services, and as long as you're homebound, which means you have trouble leaving your home without help, like using a cane, wheelchair, walker, or crutches, special transportation, or help from another person because of an illness or injury. Leaving your home isn't recommended because of your condition. You're normally unable to leave your home because it's a major effort. You pay nothing for covered home health services. However, for Medicare covered durable medical equipment, you pay 20% of the Medicare approved amount. The Part B deductible applies. Home infusion therapy services, equipment and supplies. Medicare covers equipment and supplies like pumps, IV pulls, tubing, and catheters for home infusion therapy to administer certain IV infusion drugs like intravenous immune globulin. At home, Medicare covers certain equipment and supplies like the infusion pump and the infusion drug under durable medical equipment, page 40. Medicare also covers services like nursing visits, training for caregivers, and patient monitoring. You pay 20% of Medicare approved amount for these services for the equipment and supplies in your home. Kidney, renal dialysis services and supplies. Generally, Medicare covers 3 dialysis treatments or equivalent continuous ambulatory peritoneal dialysis per week if you have end-stage renal disease, ESRD. This includes renal dialysis drugs and biological products, laboratory tests, home dialysis training, support services, equipment, and supplies. The dialysis facility is responsible for coordinating your dialysis service at home or in a facility. You pay 20% of the Medicare approved amount. The Part B deductible applies. Kidney disease education. Medicare covers up to 6 sessions of kidney disease education services if you have stage 4 chronic kidney disease that will usually require dialysis or a kidney transplant, and your doctor or other qualified healthcare provider refers you for the services. You pay 20% of the Medicare approved amount per session if you get the service from a doctor or provider. The Part B deductible applies. Laboratory tests. Medicare covered medically necessary clinical diagnostic laboratory tests when your doctor or provider orders them. These tests may include certain blood tests, urinalysis, certain tests on tissue specimens, and some screening tests. You generally pay nothing for these tests. Preventive services. Lung cancer screenings. Medicare covers lung cancer screening tests with low-dose completed tomography. Gosh, I can't even say it. Tomography? No. Geez. Sometimes medical words just don't jive with me. Okay, once per year if you meet these conditions. You're between 50 to 77, you don't have signs or symptoms of lung cancer, you're asymptomatic, you're either a current smoker or you quit smoking within the last 15 years, you have a tobacco smoking history or at least 20 pack years, an average of 1 pack, 20 cigarettes per day for 20 years. You get an order from your doctor. You pay nothing for this screening test if your doctor accepts assignment. Before your first lung cancer screening, you'll need to schedule an appointment with a healthcare provider to discuss these benefits and risk of lung cancer screening to decide if the screening is right for you. Lymphedema compression treatment items. If you've been diagnosed with lymphedema, Medicare may cover your prescribed gradient compression garments, standard and custom fitted. You pay 20% of the Medicare approved amount and Part B deductible applies. Preventive services. Mammograms. Medicare covers a mammogram screening to check for breast cancer once every 12 months. If you're a woman, 40 or older, Medicare covers one baseline mammogram. If you're a woman between 35 and 39, you pay nothing for the test if the doctor or other qualified healthcare provider accepts assignment. Part B also covers diagnostic mammograms more frequently than once a year when medically necessary. You pay 20% of the Medicare approved amount for diagnostic mammograms. The Part B deductible applies. Note, Medicare covers medically necessary breast ultrasounds only when your doctor or provider orders them. Preventive services, medical nutrition therapy services. Medicare covers medical nutrition therapy services if you have diabetes or kidney disease, or if you have a kidney transplant in the last 36 months and a doctor refers you for services. Only a registered dietitian or nutrition professional who meets certain requirements could provide medical nutrition therapy services. If you have diabetes, and you may also be eligible for diabetes self-management training, page 39, you pay nothing for medical nutrition therapy preventive services because the deductible and coinsurance don't apply. Note, if you are in a rural area, you may be able to get a medical nutrition therapy service from a registered dietitian or other nutritional professional through telehealth. Okay. Preventive Service Medicare Diabetes Prevention Program. If you have prediabetes and meet other eligibility requirements, Medicare covers a once per lifetime health behavior change program to help you prevent type 2 diabetes. The program begins with 16 weekly core sessions led by coaches in a group setting over a 6-month period. Once you complete the core sessions, you'll get 6 monthly follow-up sessions to help you maintain healthy habits. You could attend sessions in person, virtually, or both. You get these services from an approved Medicare Diabetes Prevention Program supplier. These suppliers may be traditional healthcare providers, organizations like community centers, or faith-based organizations. To find a supplier and learn more about the program, visit medicare.gov/coverage/Medicare-diabetes-prevention-program. If you are in a Medicare Advantage plan, contact your plan to find out where you could get these services. Mental health care, outpatient. Medicare covers mental health care services to help with conditions like depression and anxiety. These visits are often called counseling or psychotherapy and could be done individually in a group psychotherapy or family settings, and in crisis situations. Coverage includes services generally provided in an outpatient setting like a doctor's or other healthcare provider's office, hospital, outpatient department, or by telehealth, including visits with a psychiatrist or other doctor. clinical psychologist, clinical nurse specialist, clinical social worker, nurse practitioner, or a physician assistant. Medicare covered mental health care includes services provided by marriage and family therapists and mental health counselors. Partial hospitalization services are given by a community mental health center by a hospital to outpatients. This structured day program offers outpatient psychiatric services as an alternative to inpatient psychiatric care. Intensive outpatient program. Services that include intensive psychiatric care, counseling, and therapy. These services may be given in hospitals, community mental health centers, federally qualified health centers, rural health clinics, and opioid treatment programs when services are for the treatment of opioid use disorder. Partial hospitalization and intense outpatient services are for more hours than care you'd get in a doctor's therapist's office. To learn more, visit medicare.gov/coverage/mental health care/hospitalization. Generally, you pay 20% of the Medicare approved amount, and the Part B deductible applies for mental health care services. Part A covers inpatient mental health care services you get in a hospital, page 27. Obesity behavioral therapy. So this is a preventive service. If you have a body mass index, BMI, of 30 or more, Medicare covers obesity screenings and behavioral counseling to help you lose weight by focusing on diet and exercise. Medicare covers the counseling if your primary care doctor or other primary care provider gives you the counseling in a primary care setting like a doctor's office, where they could coordinate your personalized plan with your other care. You pay nothing for this service if your primary care doctor or other care provider accepts assignment. Occupational therapy services. Medicare covers medically necessary therapy to help you perform activities of daily living like dressing or bathing. This therapy helps to improve, maintain certain current capabilities to show decline when your doctor or other healthcare provider certifies you need. You pay 20% of the Medicare approved amount. This Part B deductible applies. Opioid use disorder treatment services. Medicare covers opioid use disorder treatment services in an opioid treatment program. The service includes medication like methadone, buprenorphine, naltrexone, naloxone, and nalmefene hydrochloride, dispensing and administering medications, substance use counseling, drug testing, and individual and group therapy. Intake activities, periodic assessments, and intensive outpatient services. Medicare covers counseling, therapy service, and periodic assessments both in person and in certain circumstances, virtually using audio and video communication technology like your phone or computer. Medicare also covers services given through opioid treatment program mobile units. Medicare pays doctors and other providers for office-based opioid use disorder treatment, including management, care coordination, and psychotherapy counseling activities, and allotment and distribution of medications. Under original Medicare, you won't have to pay any co-payments for these services if you get them from an opioid treatment program provider that's enrolled in Medicare and meets other requirements. However, the Part B deductible still applies. Talk to your doctor or other healthcare provider to find out where to go for these services. You can use medicare.gov/coverage/opioid-use-disorder-treatment-services to find a program near you. Medicare Advantage plans must also cover opioid treatment program services, but may require that you go to an in-network opioid treatment program, since Medicare Advantage plans can apply copayments to opioid treatment program services. Check with your plan to find out if you have a pay a copayment. Okay, we are at page 48, outpatient hospital services. Medicare covers many diagnostic and treatment services you get as an outpatient from a Medicare participating hospital. Generally, you pay 20% of the Medicare approved amount for your doctors or other healthcare provider services. You may pay more for services you get in a hospital outpatient setting than you'll pay for the same care in a doctor's office. In addition to the amount you pay the doctor, you'll also usually pay the hospital a copayment for each service you get in a hospital outpatient setting, except for certain preventive services that don't have a copayment. In most cases, the copayment more than the Part A hospital stay deductible for each service. The Part B deductible applies except for certain preventive services. If you get hospital outpatient services in a critical access hospital, your copayment may be higher or may exceed the Part A hospital stay deductible. Cost and coverage. Get cost estimates for hospital outpatient procedures done in hospital outpatient departments. Medicare.gov/procedure-price-lookup. Outpatient medical and surgical services like supplies. Medicare covers approved procedures like x-rays, casts, stitches, and outpatient surgeries. You pay 20% of the Medicare approved amount for doctor or other healthcare provider services. You generally pay a copayment for each service you get in a hospital outpatient setting. Most cases, the copayment can be more than the Part A hospital deductible for each service you get. Can't. The Part B deductible applies and you pay all cost items of services that Medicare doesn't cover. Physical therapy services. Medicare covers evaluation and treatment for injuries and diseases that change your ability to function or to improve or maintain current function or show decline. When your doctor or healthcare provider includes a nurse practitioner, clinical nurse specialist, or physical assistant certifies you need it. You pay 20% of the Medicare approved amount. The Part B deductible applies. Preventive services. Pneumococcal shots. I don't know if I'm saying that right. It's PNEUMOCOCCAL shots. Pneumococcal shots. Medicare covers pneumococcal shots or vaccines to help prevent pneumococcal infections like certain types of pneumonia. That's awesome. I didn't know there was a shot for pneumonia. And I just hear many pass. Not many, but I hear instances where people have passed from pneumonia. So this might be good. Talk with your doctor or other healthcare provider about this vaccine. You pay nothing for these shots if your doctor or other healthcare provider accepts assignments for giving you the shots. Pre-exposure prophylaxis prep for HIV prevention. If you don't have HIV, but your doctor determines you're at increased risk for HIV, Medicare will cover additional HIV preventive services. This includes PrEP, medication, counseling services, and a one-time hepatitis B screening. Hepatitis is actually on a rise, so many doctors are asking patients to test for that and get the vaccine. So just a side note there. If you get PrEP medication from Part B enrolled pharmacy, you'll pay nothing out of pocket for your medication. And if your doctor accepts assignment, you'll also pay nothing out of pocket for HIV, hepatitis B virus screenings. And because they're preventive services, visit medicare.gov/coverage/pre-exposure/prophylaxis/PrEP for PrEP-4-HIV- prevention to learn more about PrEP-related services. As you could tell, I'm an expert in insurance, but when it comes to medical terms, just anything medical, I would say nurse, doctors, they don't run in my family. We're more business entrepreneurship, maybe accountants, but never in that nursing or medical field, right? But hey, to each their own, and this is my specialty. Principal Care Management Services. Medicare covers disease services to help you manage a single complex chronic condition that puts you at risk of hospitalization, physical or cognitive decline, or death. If you have one chronic high risk condition that you expect to last at least 3 months, like cancer, and if you aren't being treated for any other complex conditions, Medicare may pay for a healthcare provider to help manage it. Your provider will create a disease specific care plan and continuously monitor and adjust it, including the medicines you take. The Part B deductible and coinsurance applies. Note, Medicare may also cover principal illness navigation services for your chronic high-risk condition. These services can help you understand your medical conditions or diagnose and navigate the healthcare system to find the care and providers you need. Visit medicare.gov/coverage/principal-illness-navigation-services to learn more. Preventive services, prostate cancer screenings. Medicare covers digital rectal exams and prostate-specific antigen PSA tests once every 12 months for men over 50, starting the day after your 50th birthday. For the digital rectal exam, you pay 20% of the Medicare approved amount. The Part B deductible applies. You also pay copayment in a hospital outpatient setting. You pay nothing for the PSA test. Prosthetic orthotic items. Medicare covers these prosthetic orthotics when a Medicare enrolled doctor or other healthcare provider orders them. Arm, leg, back, and neck braces, artificial eyes, artificial limbs, and their replacement parts, and prosthetic devices needed to replace an internal body organ or function of the organ, including ostomy supplies, parenteral and enteral nutrition therapy, and some types of breast prosthesis after mastectomy. Oh, for Medicare to cover your prosthetic or orthotic, you must get it from a supplier that's enrolled in Medicare. You pay 20% of the Medicare approved amount. The Part B deductible applies. Okay, pulmonary rehabilitation programs. Medicare covers a comprehensive pulmonary rehabilitation program if you have moderate to very severe chronic obstructive pulmonary disease, which is COPD, and have a referral from a doctor who's treating it or has confirmed or suspected COVID-19 and experienced persistent symptoms, including respiratory dysfunction for at least 4 weeks. You pay 20% of the Medicare approved amount if you get the service in a doctor's office. You also pay a copayment per session. If you get the service in a hospital outpatient setting, the Part B deductible applies. Yeah, I have been seeing a lot more clients with some type of respiratory issue. Some doctors can't even explain it, or they have to go to several doctors to get a correct diagnosis. But it is rampant that I've seen, especially after COVID. So just something to note if you are actually experiencing respiratory dysfunction. Okay, so we are going to end at page 50. As always, my name is Jennifer Lee, your Medicare 360 show host. Call me anytime, message us via Instagram or the radio show, and we'll be more than happy to help assist you with your Medicare needs. Thank you and have a wonderful day.